All right, so our recording has started. My name is Jamie O'Connor, and I am with Family Voices of Minnesota. Everyone here is joining us for the Health Coverage Options in Minnesota webinar regarding understanding medical assistance, Tephra, and waivers. Kim, if you'll advance the slide, I'll do a quick introduction of Family Voices. For those of you who are not familiar, we provide information, assistance, and support, emotional support to families who have children with any type of special help need. We do this in a variety of ways. All of our staff members are also parents of children with special help needs, and we can connect families with other parents who have children with similar needs or who are quite savvy navigating systems. We offer emotional support. We do have some virtual and in-person parent networking groups, and our monthly newsletter and webinars like this one. Kim, if you'll advance to the next slide. So Family Voices of Minnesota is the state affiliate organization of Family Voices National, and our connected program is the state alliance member of Parent to Parent USA. We're here today with Kimberly Hicks from the Minnesota Department of Human Services, and she is the policy lead on the EIDBI benefit. That's the Early Intensive Developmental and Behavioral Intervention benefit. I will send you information if you haven't heard about the upcoming webinar on that benefit in a follow-up email after this webinar. Also, in that follow-up email, you will see a link to a survey, and it's very, very important to the work that we do to get a little bit of feedback. It won't take but a couple of minutes, so I am hoping that everyone who attends will take a minute just to send some feedback. So Kim Hicks has worked in the field of disability services for over 20 years. She's worked as a direct support professional, autism service provider, special education teacher, advocate, and she works in state policy. Kim is part of a diverse family in greater Minnesota. She raises 3 children with disabilities, including Autism Spectrum Disorder. Kim is active in her local community, and she's passionate about providing information so all families can make informed choices to meet their children's unique needs. Kim has had 11 years of experience when she started her own family, and she knew how things were supposed to work, and then experiencing firsthand how they did not ignited her passion for making change. Kim, welcome. We're so glad that you're here and that you're spending your time helping to share this information.
Thank you so much, Jamie, and thank you all for being here today and for hearing about these options that may benefit your children. And I will add, I actually have a 4th child who who has a significant chronic medical condition. And so my expertise around navigating the healthcare system was really fascinating with her. If there's anybody on the line who has experienced pediatric ICU and all of the things that come with those intensive health needs, then you know exactly what I'm talking about. And so we will talk today about different healthcare coverage options. We're going to talk a little bit about how those are accessed in Minnesota, and also we are going to talk a little bit about autism healthcare coverage laws in Minnesota as well. So healthcare coverage sort of lives in 2 buckets. We have the private insurance bucket and we have the public insurance bucket. So private insurance is the insurance you get through your employer, usually with payroll deductions out of your paycheck, or private insurance that you maybe purchase but not using MNsure. So there are insurance companies that aren't on MNsure that people sometimes just purchase a private plan through. That is an option, and some people do that. And then we have the public health insurance bucket, and that bucket got a lot bigger after the ACA. And so people a lot of times think public health insurance is just medical assistance, and that is a component of public health insurance is income-based medical assistance. But we also have Minnesota Care, which is a program that allows families to buy into an insurance provided through the state based on their income. There are income limits for Minnesota Care and requirements about other insurance options and things of that nature. And then we have MA-TEFRA, which is a program we're going to talk about in depth in this presentation. And then I've added on here prepaid health plans because many times people aren't aware that their health insurance through the state is on a prepaid health plan. Those are for individuals, many times children, who qualify for medical assistance based on family's income. Then they would be automatically put onto a prepaid health plan unless there was a reason to move them over to straight, what we call fee-for-service Medicaid. And the different types of Medicaid that your child qualifies for, the reason that we talk about that is because different types allow you to access different services. Something that I want to make sure that families are aware of is that it may, if the county deems your private insurance cost effective, some folks have both, and there are benefits to that as well. So we'll talk a little bit about that as we go a little further. I do want to just touch on the autism law. Minnesota is one of 33 states that has a autism insurance legislation. It passed in 2013. It requires that all large insurers cover for diagnosis, treatment, and evaluation of people with autism. However, the way the statute is written, it's not very specific about what constitutes coverage. I want to make sure that people understand that this law only applies to large employers and that self-insured plans are not regulated by the Department of Commerce in Minnesota, therefore not under the protection of this law. And I mention that because we have a lot of large self-insured plans in the state of Minnesota. My husband works for one company in Minnesota that is a self-insured plan. And so a self-insured plan is a plan that many times is managed by a traditional insurance company, but the employer themselves insure the plan. And so what is covered by those plans varies significantly. So just want people to be aware of that, just to make sure that you can see whether or not your plan covers certain things. I did want to mention that the Minnesota State Employees Healthcare Plan, if you work for the state of Minnesota, does provide coverage even though it is a self-insured plan. So when you start trying to decide if you have coverage for the services that you're seeking for your child, always review your policy. Identify if your employer is state regulated, so is it a self-insured plan or a commercial plan? Ask the providers that you're calling if they're in your network before you make the appointment. Ask providers what codes they bill and check those codes with your insurance company. Call your insurance, describe the service, give the codes, have the conversation. Ask the provider to attain an authorization and keep a copy of that authorization for your records in case there were to ever be any confusion about what was allowed or not allowed. And if treatment's not included in your plan, then maybe this is an opportunity to consider medical assistance. I did give the link to the Department of Commerce if anybody is struggling with their private insurance and it wants to file a complaint or learn more. I provided that link in the PowerPoint. So now we're going to talk about getting public insurance through the MNsure site and the different types of programs that might be helpful. I've included the link to MNsure, the phone number, and also the paper application to help navigate that. So one of the first questions I hear when I say you can look at medical assistance is I hear, well, we make too much money. And in Minnesota, we have a program for families of children with special health needs that allows you to buy into medical assistance through Minnesota TEFRA, the Tax Equity and Fiscal Responsibilities Act. TEFRA is designed for families whose income is too high for MA. I've included the link because it's always good to have these links to review because things do change. TEFRA is legislatively outlined and so therefore can change based on legislative changes. And so I always like to double check and keep those marked in case anything changes. Sometimes I miss a bill that might come through. There are no asset limits to TEFRA, and I think that is a misunderstanding. People think that TEFRA has an asset limit, like if I own a house or I have a car or I have a big 401k or have a big savings account, I won't qualify, and that's not true. There is no asset limit for TEFRA. You do need a disability determination, however, to access TEFRA. And so to do that, we use something in the state of Minnesota called the State Medical Review Team. However, if your child is on SSI, you don't need a SMRT because you would automatically qualify for Medicaid as SSI. The federal government has decided your child is disabled, so the state accepts that certification. However, SSI, so Supplemental Social Security, does have an income need component to it. And so there are many children who absolutely have significant disabilities, but whose families do not receive SSI because they do not have financial need. The SMRT process is the way that we certify someone disabled to access services if they don't qualify for SSI. I have included the link for the SSI child listing book here because I think a lot of times people are like, well, I don't know what they're looking for. This is all public information. You can look up specific conditions and look and see exactly what they're looking for. And the reason that can be helpful is because if you're applying for SMRT or SSI and you know what they're looking for, then you can provide the correct medical documentation for what they're looking for. I'm not sure about any of you, but I know some of my kids' medical files could be a small library, right? And I know that Social Security and SMRT, either or, will request my child's medical records. But that is going to be a book. And they may not request all of them. They may miss certain years, or maybe they won't get it from this specialist, maybe they won't send it, but I have those records. And so if I know what they're looking for to determine certification of disability, I can make copies of those records. I can submit those records. I can organize those records in a way that make it a little bit easier to help them understand what is going on. And that's not always the case for everybody. It depends on the child. Some kiddos are pretty straightforward and it's not real complicated. Others are more complicated. They have more detailed medical histories, and so having that can be helpful. You can do SMRT alone. You don't have to do SSI. That's also a confusion. People think that for children, you have to still apply for SSI. For adults, for a SMRT, you do have to apply for SSI if your child's over 18. But if your child is under 18, you do not have to apply for SSI. You can just apply for SMRT. You can do one or you can do both. And you can also do a SMRT during an appeal. So how do you get certified disabled to start the TEFRA process? You can request it from the county. They're going to have you fill out a children's disability worksheet and a release of information. On that children's disability worksheet, I know how so hard it can be to basically focus on everything my child can't do. It is uncomfortable. It is not fun. I don't like it at all. Explaining how their disability affects our family life, our ability to participate in the community, all of that is hard. But it does really need to be a true picture of how the disability is affecting your family and how the special health needs are limiting your child's access to certain things and what you're looking for. Because if everything was fine, which is what I always say, people are like, how are the kids? Fine. Everybody's fine. It's fine. But if it was really fine, I probably wouldn't be seeking services, right? Because if it was fine, I wouldn't need anything. There's a reason why I'm seeking services, and you want to make sure that as you fill out that children's disability worksheet, that reason comes through. I'm a big fan of having somebody else take a look at it. When I do it, I usually, I'll write it on a piece of paper before I put it on the form. And I will ask somebody else who doesn't live in my world to take a look and see if it sounds like it describes our family. Because they usually see things that have become normal for me. And so I may not see them as ways that they're impacting our family. I don't even notice, but they're absolutely there. The SMRT process it can be long. I would like to say it happens within 90 days, but it can be longer than 3 months. But again, providing all of that information can really be helpful. And just as a reminder, SMRT is about access to services. There's no income attached to it, unlike SSI that has income attached. But SSI has income, but it also has income limits. SMRT does not have income, but it does not have income limits. So understanding the difference there. Excuse me. So let's say you get through the SMRT. Yay! Gotten the certification of disability, and now you're eligible for TEFRA. You're going to be asked to fill out a form to identify your parental fee and submit your taxes. Your parental fee is based off of your adjusted gross income and your family size. So the reason I point out this adjusted gross income is that is a number that no one knows, myself included. I have no idea what that number is. I know what that number is the day we file our taxes, and never again. Because that's the number on the bottom of your taxes. So it's after you filled out everything and all of those pieces have come off, and it's that bottom number. And so what that AGI looks like, most people can't tell you. They can tell you their gross salary, they can tell you their net salary, but most people can't tell you what their adjusted gross income is. So before you get on and look at your possible parental fee, pull out your taxes. The other thing I want you to be aware of is that secondary MA will likely cover most, if not all, of your copays and deductibles and out-of-pocket costs for your families that otherwise your child who's certified would have had. So the only reason that they wouldn't is if your provider was not enrolled with MA. And little known fact, well, maybe not little known to me, I didn't know this until it was too late, one parental fee per family, not per child. So once your parental fee is established, if you have one child or you have 3 children who are certified disabled, it's one fee. So just something to be mindful of. You can estimate your parental fee on the Parental Fee Estimator. You can pick the year and it'll just, you can just type it in. There is also a worksheet that will allow you to do math. If you would like to do math, I've given you the form. I don't like to do math, so I'm a big fan of the Parental Fee Estimator. And again, before you get on and play with the Parental Fee Estimator, please, please, please take out your taxes. Look at your actual AGI, just to make sure that you're getting the right information so you can make an informed decision. The other thing is to consider the cost and timing of services your child will be receiving. So it's March. And so depending on kind of where your family's at, that this may be a good time. I talked to a family last November who was like, well, we've already hit our out-of-pocket max for the year. We've already hit our deductible for the year. We are waiting to get our Min Choices assessment. They're coming out the week before Christmas. Should we start our parental fee now? No. Your Medicaid's not going to cover anything between now and the end of Christmas. It was the week of Thanksgiving that I spoke to them. So she called and requested that they turn the MA on January 1 so that they weren't paying a parental fee for months when they weren't getting any services. So I always hear from folks, well, is parental fee really worth it? And I will tell you that advocacy around the Tephra fees has lowered the fees consistently for several legislative sessions. So we have really seen fees come down. But it is a valid question to decide whether or not it's worth it. The other thing is that depending on your insurance plan, you may have a situation where you have an individual deductible and a family deductible, and an individual out-of-pocket and a family out-of-pocket. And so depending on your child's needs and when those medical bills ensue, you could see your overall family deductible and out-of-pocket be lower because Medicaid will have covered your child's portion, which would have occurred, could have occurred before other family members used theirs. So that's something to be mindful of. So let's do an example. The Andersons have 3 children and 2 married parents living in the household. They have a son, Cole, who has a diagnosis of autism. So they only have 1 child with autism. Their adjusted gross income is $90,000. Currently, their healthcare coverage is through Mary's employer. Their monthly premiums for family coverage are $500 a month. Their individual deductible is $700 per person with a family deductible of $1,400. The out-of-pocket max per person is $3,000 with a family out-of-pocket max of $6,000. Their pharmacy benefit is separate, and they spend $75 a month on medications for Cole. So that's what the Andersons' life looks like. So let's see if Tephra would be positive for the Andersons. Every year, due to Cole's therapies, the Andersons have to pay his $700 individual deductible. They know that. They've been doing it for a couple of years. If they were on Tephra, Tephra would cover Cole's copays for his medication, which is currently costing the family $900 a year. So this means currently the Andersons are spending $1,600 out of pocket on Cole's medical care across the board. They always hit the deductible. They always have the med costs. Okay, there's other costs they may be ensuing. They have copays for after they hit the deductible. Maybe they're paying out of pocket for support staff for Cole or a babysitter for Cole when Cole's old enough to not need one. But excluding all of that, just looking at those two facts alone, their parental fee would be $132.28 a month based on $90,000 of adjusted gross income, family of 5. That means yearly, they would have $1,587.36 in fees for parental fee. They know they're going to spend at least $1,600, and for $12 less a year, they could have that wiped out. So, and if their plan is determined cost effective by the county, they could, in theory, be reimbursed Cole's portion of the premium, so $100 a month from that, which could even lower that even further. So this is before Cole has copays outside of the deductible. This is before Cole accesses home and community-based services. This is before any of that. This is just deductible and meds. And so for the Andersons, this appears to be worth it. We talked a little bit about Social Security, but I do just want to mention that, again, that Social Security for minor children is going to request that you go through a financial piece first. You really are encouraged to call your local office to determine if you meet the financial criteria. There are both income and asset limits for Social Security for youth. So just being really mindful of that when you start, if you choose to start that process. And again, just like with SMIRT, you can submit documentation to Social Security too. So all of those files and files of papers you have will come in handy. And because every good advocate relies on other good advocates, I've included the link to some of the ARC guides that can help kind of walk you through some of those processes as well, if you want to read up on them in depth. So when we talk about healthcare and treatment services that Minnesota Medicaid can cover, we're talking about private therapies such as occupational therapy, speech therapy, physical therapy, and these are different from the therapies your child's getting at school. So educational therapies are about what's needed to access education, free and appropriate education. Medical therapies are really looking at different things and are paid through your insurance. So when we talk about all the things that Tephra can, or that medical assistance can cover, these are all parts of that. Also those specialty cares, being able to access those, and then medication management, imaging, any of that kind of stuff, any of those traditional medical services. My colleague Nicole will be sharing information about the autism benefit as well at her webinar, and also Minnesota Medicaid covers those services, and some private insurances cover it as well, as we talked about with the autism statute. We do have an ASD website that is through the Department of Health. We also have a interagency ASD portal that can be really helpful that I would encourage folks to look at. This, in the state of Minnesota, if anyone is interested in autism trainings specifically, we do offer ASD strategies in action. And that is either as little as 10 hours or as much as 40 hours of autism training online at your own pace, however you choose to do it. And you get to pick an age category. You can do all 3 age categories or just one. So it's preschool, school age, and transition age. And it's free. We offer it in the state of Minnesota to anyone who would like to access it. You just send us an email and we get you signed up, and you can take a look at that if that's of interest for you. We also have a multicultural training that really is about how to work with families in Minnesota who maybe don't have the same cultural background as you, or even have the same cultural background as you, but maybe operate a little bit within their own culture as a family. And so how to kind of navigate through that system, because in many cases, particularly around autism, a lot of what we work on is social, and a lot of what we deem as social is determined by our families. So, and then we also have EIDBI 101, which is my personal favorite. So if during this webinar today you were like, that was a lot of information really fast, I do apologize for that. But this link, this EIDBI for Families link, also covers all of these healthcare items, waivers, min choices, assessments, all of that is included in there with all of the same links that we talked about also linked in there. So you can take it at your own speed and own time and look at that. Because anytime I'm in front of people, I want to take the opportunity to talk about the difference between medical identification and educational determination. Particularly when we're talking about autism, there are conditions, including autism, that have a medical diagnosis, and then a child may be receiving special education through an educational determination at school. However, those two things do not always align for children to be able to access the services and supports they need. And so just as a reminder, making sure you have the diagnosis that you need medically to access the home and community-based services or other medical services you may need, and making sure that you have the educational determination that your child needs to be successful in school. An educational determination really focuses on the IEP of the child, categorical disability areas, and they have to show an educational need. So just because a child has an educational determination does not mean that they have a medical diagnosis. A medical diagnosis really determines what services and supports might be necessary for the family from a medical lens. It also does not automatically mean the child may have an IEP. They may have an IEP under a different label or may not even have an IEP. So you will need that medical diagnosis many times to access those services we discussed. So let's talk about home and community-based services, because I've mentioned it a couple of times without really getting in depth about them. So we have, in Minnesota, we use something called the Min Choices Assessment to determine what services a child may benefit from, or adult. We actually use it across the age range. I did include here the What to Expect brochure. That's a DHS brochure. And the reason that that can be really helpful is because if you know what to walk into going into a Min Choices, if you know what to expect, then you're more prepared to ask questions. You're more prepared to engage in a conversation with the Min Choice assessor, and you can feel empowered and an equal partner during that process. Because I don't know about anybody else, but it can feel really intimidating to have somebody come into your home and ask you a lot of questions. And it can kind of feel on the spot, and it's kind of an awkward situation. But if I feel prepared beforehand, I know I do better. And I feel like I do a better job advocating for my child. And so that brochure is really nice. And ARC also has a really good guide to the Min Choice assessment that can be really helpful. Once you have a Min Choices assessment, it's going to determine what services may be beneficial for your child. And so we always hear about the waivers. And the waivers are a way to use Medicaid funds differently to meet the home and community-based service needs of a child. If you have questions about the waivers, we'll have some links in here, but there's this wonderful resource of the Disability Hub MN. If you've never used the Hub, I strongly recommend them. They are wonderful. So they are open from 8:30 to 5, Monday through Friday. And they have a phone number, and they can help you navigate through the system. They can help you call the county. They can provide resources. They also, if you click on the link, have a chat feature, which I really enjoy because I sometimes don't want to talk to a human. And I find that to just be lovely. One time I got a letter that something had happened with one of my children's medical assistants, and I was like, what is going on? And the social worker was on vacation, and I just messaged the hub, and they were able to walk me through and explain what had happened and what I needed to do, which I found to be just really a wonderful service. So waiver, once a child has qualified for a waiver, you can access a variety of services. So some of those services are case management, specialized treatment, certain equipment and supplies, long-term employment supports, a variety of things. Case management can be offered without a waiver. Certain types of case management, certain types do also come with a waiver. But not everybody qualifies for a waiver. Waivers are the highest level of need service that we have. And so sometimes families will access grants first. So we have the Family Support Grant, which is a grant to help with children and families whose children are certified disabled. The amount of the grant is based on individual needs. It can't be more than $3,113.99 for an eligible child. There's a fact sheet on here. FSG does not require MA. So for some families that maybe aren't using the Tephra SMRT option, an FSG can be a really good choice. A CSG grant is a grant that is an alternative to PCA dollars. So it's a way to create a support plan and use those dollars a little bit more flexibly. The thing about a CSG is not all counties participate. And it really is based off of that Min Choices assessment. It does require MA. There is eligibility criteria, and I've included those links. But it could be a really good starting point for families whose children maybe haven't reached the level of waiver need yet. You do develop that plan like we talked about. It can pay for a variety of things like PCA or other expenses, equipment, different things that aren't necessarily aren't covered by medical assistance. It really does have a lot more flexibility and freedom of choice. You can do paid parent under CSG, so that's something to be mindful of as well. Here's the Hub's website. So see, I'm going to take my mouse and just run right here. See this fun little chat feature? You can live chat with them, and it's wonderful. But in addition to that, they also really have a lot of tools, income estimators, information about different things that might be of interest. I find it to be a wonderful place to start when you have questions, and to quickly be able to get to a human. They are funded through a grant through DHS and connected directly to DHS, so the information you receive is usually is very good and very neutral. They're not connected to anybody else. I do have some other resources on here that I just want to quickly cover. One is the Ombudsman for OMHDD. So this is the Office of Mental Health and Developmental Disabilities, and they are an advocacy organization statewide. They're public. They are a state agency that you can reach out to if you're having issues with accessing or navigating through those systems due to what you believe to be inaccurate information and complaints. So, Managed Care Ombudsman. Boy, that's a hard word today. For those folks that are on the PMAP plans. This is the new Autism Resource Portal. And actually it has changed. We just updated the picture. We have relaunched it. I am so proud of this website. It has a ton of resources on it. It has been a labor of love through the interagency groups and really shows through in its integrity and ability to access information. It's really a portal, so it just has like short descriptions, but lots of links to other resources. So please, 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 if you're interested, take a look. We also have the ASD Strategies in Action, that training I talked about. Again, just plug in that as a free opportunity for you all to learn, and anyone else too. It doesn't have to be just parents. It's open to all Minnesotans, and I don't check addresses. So if you've got a grandma who frequently spends time with your child who you think could benefit, she can enroll in it. Babysitters, aunts, cousins, anybody. We also have on the Autism Spectrum videos, and these are videos that were created in collaboration with real Minnesota families who have walked through the autism journey from different communities and kind of explaining what their journey looked like, and kind of giving a window into their lives, and hopefully in a way to help people feel connected to other folks. And then I always want to do a plug for Family Voices. So Family Voices, where you can get connected, find resources, find support, and their contact information. They were kind enough to do this webinar and then the following webinar that's coming up in April, along with a variety of others on their website. Being the parent of a child with unique needs can be isolating. Sometimes it can feel like you're on an island, and maybe your natural support network has never navigated off of this island before. And so having another parent who has been on the same island and can show you where the boats are is really, really helpful. And so they provide a wonderful opportunity to do that. That is my contact information. That is my direct email. And you are welcome to send me an email or call me. And then we also have the ASD inbox, where you can also send any questions or information for anyone that is interested. So that is, and then of course the acronyms, the alphabet soup, as we like to call it, is included here as well, in case you weren't sure. So those are there too. So that's all I had for the formal presentation. If anybody has questions, I would be happy to take those.
Kim, thank you so much. Just so everyone knows, we will be sending out the slides, so you'll have access to the links, as well as a link to the recording of this webinar on demand, as well as that survey link and information about future webinars. I am going to try to get everyone's attention. I'm going to unmute the line, and sometimes we get a little complacent when our line is muted and we have some background noise. So I would just encourage you to mute yourself if you feel like that's the case and you don't want to speak up. And anyone who does not want to speak up can also chat their question into the chat box. So with that said, I'm going to unmute everyone. All right. So you are welcome to send out if you have questions.
Did I do such a good job that nobody has a single question? That is impressive.
Hi, my name is Heather, and I just want to make a comment about the parental fees. Is just because I live in a family where my son's biological father is not in the household, but I'm remarried. And so parental fees is only the biological parent, not the whole household if it's a step-parent situation. So.
Thank you, Heather, for pointing that out. That is something that is frequently forgotten. And then we have a question on the chat about divorced parents in joint custody. So, so Heather just explained the remarried part. I will explain the joint custody. So each individual parent gets a Tephra fee based on their individual income situation. So it's not one or the other, it's both. And one parent's refusal to pay does not stop the child's services. So that's the other thing to be mindful of. So both parents will fill out the parental fee form, and the parental fee unit will send both parents a bill separate from each other. Someone else mentioned care coordination through your primary care provider. Yes, they can be so helpful. Prior to...
Sorry.
Go ahead.
I was just going to say we're getting some background noise. So just a reminder that if you can mute your line while you're not speaking. Thanks.
Yes, care coordination through your primary care provider can be so helpful to kind of guide through that process. That's a great point. Also, like I said, there are types of case management like Rule 185 case management, developmental disabilities case management, or targeted children's mental health case management that don't necessarily require um, uh, medical assistance, and they can also help walk you through that process. You also have the Disability Hub that can help as well. And so hopefully between all of those resources, it cannot feel like you're navigating through what I can only describe as a really complicated highway. We have another question online that the child was approved for DD waiver and is looking at CDCS. I guess I don't know how to answer that specific question. So a DD waiver is a type of waiver. CDCS is changing that waiver into a consumer directed. It does take time to get a CDCS waiver set up because you have to write the plan, but I don't know, I guess I don't understand from the question kind of the details. If you want to reach out to me via email or give me a call, we can have a chat and I can try to get some more information. I apologize, I'm not completely clear there. Any other questions? I hope you all found this helpful. I know it can be a very confusing process.
Yeah, sorry, this Karthik here. I just asked that question. Yeah, he was approved with DD waiver with traditional. They said like CDCS is in progress because I was looking for like specialized therapies for him, like kind of aquatic therapy, all those things. So they said they will be done as part of CDCS. Right now, you will get only PCA. So yeah.
Yeah, that doesn't make a lot of sense to me. Why don't we connect offline and
Yeah.
I can see maybe if we talk, if I can figure out kind of what's going on, or maybe connect you to a resource in your county to kind of solve that problem.
Okay, so what is the email? Sorry, I joined late at 1 o'clock. So what is the email?
Oh,
you
it's
will
at
share.
right here on the screen right now, asd.dhs@state.mn.us.
Okay, sure. I'll send.
We will also send the PowerPoint out and you'll be able to access it there as well.
Okay.
Okay.
And I have approved for this cost-effective insurance, and they said it will be reimbursed, but I have not reached out to the county worker yet. I have a question, like, how will the reimbursement works?
So you submit your pay stubs that show that you paid your healthcare premium, and then they reimburse you for your child's portion.
So they reimburse to the bank, my bank account, or like, or
yeah, you set it up with them. I don't know that all counties do it the exact same way. My county sends a check. I think it depends on the county. And my county runs like 6 months behind. No, wait, just me? Okay.
Okay.
So I don't think that's the way it's supposed to go, but that has been my lived experience. Is it's quite a process as far as the delay in timeline.
Okay.
So just, yeah, it's fun.
Yeah. Okay.
And we have a question about sharing it online. Absolutely. This will be, as Jamie said, it will be on the Family Voices recorded webinars. And so people can access the whole thing live, not just the slides, but my not very great voice talking through them anytime as well. So that's a wonderful feature that Family Voices offers that I just think is so amazing. So thank you, Jamie, for that. I wish that there had been one of these 10 years ago. So.
Hello? Hello?
Hi.
Hi, I've got one question. We have a 12-year-old disabled child, many disabilities, has epilepsy, and I'm retired, and she is receiving Social Security under my Social Security benefit right now, and my wife is soon to be retired, and we are just trying to figure out, is there a way? I know that we're going to have to get her qualified as disabled through Social Security. But as far as, and then I think she will receive some, maybe continue receiving on my account as she becomes an adult, but we're wondering how to get her insured, what our best bet would be. And if we did use one of these like MNsure, as we are retired, would it go with would it just be on her, her wages, which she doesn't have any? We're a little lost with that because we're both.
Sure. So first of all, you're totally right. And thank you for bringing that up, because sometimes people think that Social Security, SSDI and SSI for children are the same things, and they aren't. Your child is receiving SSDI she's receiving, RSI. She's receiving retired survivors benefits under you. So she's not actually considered disabled yet. So you will need to get her certified disabled. Like we talked about in the presentation, there's 2 ways to do that. SSI is one option, but it's going to look at your entire family income, which will take into account you and your wife's Social Security.
Okay.
That may or may not mean that you qualify for the income piece of SSI. It will not affect her ability to continue to pull off of your record. Does that make sense?
Yes.
Okay. So if let's say, let's take that out of, let's say if she qualifies for SSI, she immediately qualifies for Medicaid, done and done. But let's pretend she doesn't. Let's pretend your family income and asset is too high for Medicaid. Because for a child under the age of 18, the Medicaid asset limit is $4,000. And if you have 2 cars that are both paid off, you might be over that.
Okay.
Just frame of reference. So let's pretend she doesn't qualify for SSI. Let's say she has to go the SMRT route, which we included that information in the PowerPoint about getting the certification of disability through the state, getting the SMRT. Once she gets the SMRT, then you would apply for medical assistance and look at that TEFRA option. Your parental fee is going to be based off of your adjusted gross income.
Okay. Yep.
So is that her medical insurance then?
Yep. Medical assistance will cover all of her medical insurance of all kinds. The whole works. So it's not just home and community-based options. Like we talked about, it covers deductibles, it covers co-pays, it covers whatever. If she doesn't have any other insurance, because neither one of you are currently, no longer covered under an employer plan and you're both receiving Medicare, then that would be her only insurance coverage. And there are lots of children who that's their only insurance coverage, and that's absolutely fine.
Okay.
Thank you very much.
So that sounds
absolutely.
And then as she turns 18 or 19, will we go back to the Social Security portion? Because we're going to have her, I don't know if we have to have her considered disabled at that point or not.
Yeah, when she turns 18, so there's actually another question online about when your child gets to 18 and what do you do? Yeah. So when your child turns 18, then you're going to go get certified through Social Security. And if they qualify for SSI, then they're automatically enrolled in Medicaid and you no longer have parental fees. Okay. Typically, Social Security, you do that process right at 18. If your child is already on Social Security, when they turn 18, they go in for what they call a review, where that's re-looked at.
Okay.
All right, thank you very much.
And in the PowerPoint are all of the links to the Social Security websites and all of that, so you can learn. Okay. Because it is a complicated process. However, because it's complicated, sometimes families end up paying for stuff that they don't need to pay for because all the information is out there. So before you decide you need to pay somebody, take a look. And also consider contacting the hub. If your child is turning 18 and you want information about Social Security, consider starting with the Disability Hub. They have some amazing resources about Social Security, and we have Social Security advocates across the state that have contracts with DHS that may be able to help and guide you.
Fantastic. Okay. I have one quick question that maybe I'll get through the hub, but if do you know if oh, hello?
Yeah, we can hear you.
Something just flashed up on our screen. If she was turning 18 and is disabled, will she go on SSI or will she still continue getting my half portion or whatever it's called?
So if she's certified disabled under the age of 21, she's going to be on something called Disabled Adult Child, also known as DAC. And DAC is a different kind of duck in Social Security world. It's a slightly different program. The qualifying rules are the same, but like the work rules and all kinds of those things are different. And the hub can walk you through that as she gets closer to that. But yes, the short answer is yes. She's going to probably qualify for DAC. And I would encourage you as she gets closer to 18 and you look at that to really learn about DAC, because it is kind of a unique duck, and there's some really cool benefits to DAC.
Oh, great. Thank you very much. I appreciate everything.
Absolutely. And of course, full disclosure, it's 2020, and in 6 years, I can't predict the future, so things could always change.
I understand that.
So just to kind of tag on to that conversation, so when kids turn 18 and they start to work on applying for medical assistance and for SSI, are they still under their parents' income? Does that get factored in when they are, I mean, they have to be SMRTed and they have to be shown to be disabled, but the income piece, are they now their own adult and their income is theirs? Am I making sense?
So they are considered independent in their income. For SSI, there are, you know, it does change whether or not the child's living in the home as far as like how much they get and if you're charging rent, and there's all these unique pieces of that. But yes, they are considered independent of their income. So they are considered with their assets. So their bank account, their, you know, vehicles, their whatever, all of that is theirs. It belongs to them now that they're 18. That being said, if a child is certified disabled and receiving Social Security for the purposes of vocational rehab, which we didn't even touch on today, like I could do a whole thing about just that. But for the purpose of vocational rehab, if they're certified disabled and on Social Security, they're also considered independent in vocational world for vocational rehab support for post-secondary as well. So there are benefits to getting that done, for sure.
So I get a lot of families that ask, you know, we want to know, my kid's on Social Security, disability, you know, they're going to turn 18, now is our income involved? And then DAC must be that soft space between 18 and 21 when they still have transition in high school, where they're still in those programs. Is that what that's about? I've never even heard of DAC.
No, so when they're between 18 and 21, if they're receiving Social Security, they're receiving SSI, but they're under what they call the student earned income exclusion, which is another like special cool duck. So it's the same program, but it's a different work incentive. And the whole purpose of the student earned income exclusion is because we know that high school and college age kids that have disabilities that are on SSI are likely not working consistently. They probably work a little bit more in the summer, and they're probably trying out some different job trials, and Social Security really wants them to be successful. And so the rules are slightly different for them during that time frame. There is another thing during that time frame that could be happening, which like the gentleman that shared before, his daughter's receiving Social Security, not under her disability, but under his retirement. If a child is enrolled in full-time high school and they have a deceased or retired parent, they are likely receiving survivor benefits or retirement benefits under that parent's record. And so as long as they stay full-time enrolled in school, they are able to pull that benefit. That benefit is not linked to their disability at all. And many times people think it is, and then suddenly it goes away and they're like, well, they've always qualified for Social Security. It wasn't on their disability. They were pulling off of a parent.
Okay. And when they turn 18, I've always told parents they have to connect with the Social Security office because they likely will need a reassessment. Does the Social Security office does not contact them if they're already on SSI, or do they send them a letter and say you need reassessment?
No, they do. They will reach out. It's supposed to be, I think, gosh, I don't remember the statute. I'm sorry. I think it's supposed to be 90 days before, but it's not always. It's not a perfect system. And I could have that wrong. I'm sorry. I haven't done, Social Security advocacy is kind of it's a moving target.
I know. This is why I'm asking all these questions. I'm a care coordinator at a clinic, and I get a lot of questions like this. So
So yeah, so the SSI piece, you know, when they turn 18 and they apply for SSI, most children when they turn 18 will be applying for SSI, Supplemental Security Income, because they won't have worked or had work credits. The children that are applying at 18 and not getting SSI are usually because they have a retired or a deceased parent. But if they are qualified prior to the age of 21, when and if a parent retires or becomes deceased, they may be able to pull off of that parent's record under DAC. So.
Ah, that's good to know. Oh, that's good to know. Okay. Well, thank you very much. That clarifies a little bit for me.
Yeah. Sorry, we ended up down the Social Security hole, and that was not the purpose of this presentation, but I threw some of that in there because I know it's always so confusing how SMRT and Social Security work together. It is very confusing. And
I think
again,
it was a good avenue to go down, Kim. And for me, it's really helpful to hear you repeatedly acknowledge how complex and challenging it can be. And you know, one of the things that the Connected program offers is well over 180 trained volunteer support parents, many of whom are savvy navigating these systems or have recently been through one of these processes. And so just a reminder that you can reach out and try to get connected with another parent who's been through the process recently and has some tips that also can relate with how complex it is.
And I know I've said this 100 times today, but seriously, the Disability Hub, they have work incentive coordinators, they have reps who can do a variety of things, who are very, very skilled. And again, you don't even have to like physically talk to somebody. You can just chat with folks. But seriously, they are a wonderful resource, and I think can be really beneficial, particularly when you get to that transition age and you're talking about that Social Security stuff. And if it's anything like most people's journey, I have, my eldest is 18, he's a senior this year. And so if it's anything like other people's journeys are like mine, everybody knows everything and has all kinds of advice, but nobody can ever tell me where they knew that from. Right? Like, and so having one central place that you can reach out and get information that you're sure is accurate is so helpful.
Right. Well, I'm aware of our time, and I just want to thank everyone for attending. And Kim, thank you so much for putting your energy into this and presenting and sharing your knowledge and experience with us. As a reminder, I will follow up with an email to all of the participants and registrants, and it will contain a link to a survey that I encourage you to please send us some feedback. It won't take very long. And again, the link to the on-demand version of this webinar, the slides, and future webinars.
Thank you so much for having me, Jamie. This was fun.
Yeah, appreciate it. All right. Well, everyone have a good afternoon.
Yep, thank you.
Bye.
Thank you.
Bye.